Craniopharyngioma. This tumor, typically comprising both solid and cystic components, arises between the pituitary and hypothalamus. Etiology and pathophysiology. The exact origin remains uncertain, but the tumor most probably arises from Rathke's pouch. Although histologically benign, local invasion is a frequent finding and many recur after surgery. Epidemiology. Craniopharyngiomas are estimated to account for 5 to 12% of all intracranial tumors in childhood and about 1% of brain tumors in adults. The peak incidence is distributed bimodally, with the majority of cases occurring between 5 and 14 years of age, but with a second smaller peak after 50 years of age. Clinical presentation. Childhood. Although endocrine deficiencies are common, most go unrecognized for years and only come to attention when the child presents with symptoms of raised intracranial pressure, e.g. headache, nausea, and vomiting, or visual disturbance due to the mass effect of an expanding tumor. Growth hormone deficiency, leading to growth retardation, and diabetes insipidus are the most commonly encountered endocrine disturbances. In older children, there may be pubertal delay or arrest as a consequence of gonadotrophin deficiency. Features of hypothalamic dysfunction, including disturbance of appetite or thirst, somnolence, and abnormal temperature regulation, are sometimes seen. Adulthood. Endocrine manifestations, including diabetes insipidus, are a more common presenting feature in adulthood, although many cases exhibit symptoms of raised intracranial pressure. Physical signs. Reduced visual acuity, and visual field defects as a consequence of chiasmal compression, together with papilloedema or optic atrophy, reflecting raised intracranial pressure, may be evident. Careful examination for evidence of pituitary insufficiency should be undertaken. Investigation. Where possible, initial investigation of suspected cases should include the following: MRI, or CT, scan of the pituitary fossa and hypothalamus. Craniopharyngiomas exhibit a distinctive appearance with mixed solid and cystic components, and heterogeneity of enhancement. Intracellular or supracellular calcification is often evident on plain skull radiographs. Ophthalmological review. To provide a baseline for monitoring the effects of treatment. Remember that supracellular craniopharyngiomas often compress the optic chiasm from above, leading to a bilateral inferior quadrantanopia in the first instance, before progressing to a full-blown hemianopia. This is the opposite of the situation with a pituitary macroadenoma, which compresses the chiasm from below, thus leading to a superior quadrantanopia. Assessment of hypothalamic pituitary function. Anterior pituitary function tests and paired urine and plasma osmolality with serum urea and electrolytes, to look for evidence of diabetes insipidus. Approximately 80% of patients will have pituitary dysfunction at diagnosis. Treatment. This is a rare condition and ideally patients should be referred to a center with expertise in pituitary surgery. Surgery. Up to 50% of cases have evidence of hydrocephalus on initial imaging and 1/3 require urgent surgical decompression. Transcranial subfrontal surgery may be required to allow full access to the tumor, although complete excision is frequently not possible. The cyst contents are classically said to have the appearance of engine or machine oil. NB. Unless there is clear biochemical evidence to the contrary, assume that all cases have pituitary insufficiency and ensure that adequate steroid cover is given perioperatively. Postoperative. Short-term. Postoperative care will require combined endocrine, neurological, psychological, and ophthalmological input. Since complete surgical resection is usually not feasible, adjunctive radiotherapy is often necessary and has been reported to reduce recurrence rates from 80% to 20%. Long-term follow-up is required to detect and treat regrowth of the tumor and any hypothalamic pituitary dysfunction. Prognosis. Poor prognostic features include young age and presentation with hydrocephalus. Although non-malignant, craniopharyngiomas often have a worse outcome in childhood than other malignant cerebral tumors.